Good evening, everyone. Welcome to Lecture 10. Thank you for joining us online today. The theme of this lecture series is Beyond Borders, Navigating Health Knowledge for Well-being. We frame it as implementing UHC and well-being through cross-border collaboration of knowledge and capital. In other words, we aim to bring together expertise and resources across countries and across sectors so that universal health coverage, health for all, and people's well-being can be achieved in an integrated way. More specifically, in this course, we use Malaysia as our key case study. We explore policy design through public-private partnership approaches and cross-sector collaboration. And as the final output of this semester, each of you will produce a policy brief, a concise policy proposal. But let me be very clear. This is not a course on how to write a policy brief as a format. Our core question is how do we design policy proposals that actually get adopted, that can be embedded into real institutions and survive real political and budgetary constraints. That is why today's session is especially important. We will focus not only on writing techniques, but on the craft of policy proposal that can be implemented. We are truly honored to welcome Professor Hajime Inoue as our guest lecturer. Professor Inoue has served for many years in the Minister of Health, Labor and Welfare in Japan, working across a wide range of policy areas, including UHC, community health, health emergency preparedness, health promotion, population aging, pharmaceutical policy. He also contributed deeply to the design of debates and reform in Japan's Central Social Insurance Medical Council. And internationally, he has supported the global health negotiations, including at the G7 and G20, serving as a senior advisor at the WHO. Through Professor Inoue's experience, we hope to learn the essence of policy design that works in the real world, especially at the intersections of well-being, preventive investment, and health insurance systems. Today, we first face the unavoidable reality, population aging, and a major shift in the disease burden. And then we ask a practical question. How do we translate that reality into policies and that can be implemented? Professor Inoue, thank you very much for joining us today. The floor is yours.
Kawahara-sensei, thank you very much for your kind introductions. Am I audible to you, everybody? And thank you very much for your kind invitation and giving me this opportunity. I understand that the lecture course is titled Beyond Borders, Navigating Health Knowledge for Well-being. And so that we actually need to discuss about the health agenda which is common beyond the borders. There are several actually agendas. We have a common agenda on health globally across the borders. And one of the agenda which is common across the border, there are several. One of the most important agenda is population aging. It's not an issue anymore for high-income countries. This is the issue of even low and middle income countries everywhere in the world. So I'd like to choose this agenda as the basis for us to make a policy brief. For you to make a policy brief, we need a certain basic common concept and understanding for key health agenda in the globe. One of the key health agenda in the globe, in my understanding, the most important agenda is population aging. So before actually going into the details of how to technically write the policy briefing, we'd like to pay attention on this common agenda, population aging, in this lecture. Let me try to make a slide one by one. Before going into the actual subjects, let us start by asking a quiz to you. Last year marks the 80th anniversary since the end of World War II. The World War II ended 1945, and 80 years have passed since then. There has been a substantial, improvement in health in Japan. By how many years did life expectancy in Japan increase in the past 80 years? We have 4 options. And please raise your hand virtually. Is it possible for me to see how many? I'd like to actually ask each participant to raise your hand. Is it possible? Perhaps
Can students show your hands in the meeting room? Yes, Sensei, can you see there's a student have raised their hand?
Okay, so if you think we've improved, we have 4 options. If you think we have improved 3 years life expectancy since then, since the end of the World War II, please raise your hand. Then if you think, I couldn't actually see the hands, but anyhow, if you think we've improved 10 years life expectancy since the end of the World War II, please raise your hand. I couldn't see any hands. Do you see?
Yes, Sensei, we're here 10 years.
Okay. Then if you think we've improved 20 years of life expectancy since the end of the World War II in Japan, please raise your hand.
Sensei, I think 20 years.
Okay. Then if you think we've improved 30 years of life expectancy since the end of the World War II, please raise your hand. Next slide, please. I have one more question for 4 options. Now that cancer is the biggest health challenge in Japan, and if miracle happens and all cancers were completely cured, then by how many more years of life expectancy increase in the same 4 options? If you think 3 years, raise your hand. If you think 10 years, then raise your hand. If you think 20 years, please raise your hand. If you think 30 years, if all cancers were completely cured, if you think we could improve the life expectancy by 30 years, please raise your hand. Thank you very much. The next slide actually shows the answer to these questions. Since the end of the World War II, the actual increase in life expectancy in Japan in the past 80 years is about 30 years. When the war ended, our life expectancy is about 50 plus. Nowadays, it's 80 plus, so increase is 80 years, 30 years, substantial increase of the life expectancy in the past 80 years since the end of the World War II. On the other hand, if we could actually eliminate all cancers, the actual increase in life expectancy is somehow limited, more or less 3 years. So the answer to the question 1 is 30. The answer to the question 2 is 3. Please raise your hand if you could actually hit the mark for both questions. Perhaps none of them. This is not an easy answer. This is actually beyond the expectation or the understanding of the general concept. But this actually tells us that how difficult is it to understand the increasement of the health status in the past 80 years. And please, the next slide, please. So here's the learning objective today. The first, understand the demographic transition in Japan and also the globe. Second, examine its implications for healthcare and health professionals. Thirdly, consider optimal policy implementation strategies in Japan and in your home countries, which is, in my understanding, the basics to understand the cross-border common global health agenda. Next slide, please. I said that we've actually increased 30 years of life expectancy since the end of the World War II. This is mainly achieved by the improvement in the child health. What we have achieved here, trends, I actually showing you the trends in infant and under 5 mortality rate in Japan. Under 5 mortality rate is defined as the number of babies who could not reach to 5 years old out of 1,000 newborn babies. So 100 years ago in 1920s, 160 to 170 the children out of 1,000 newborn babies could not reach to 5 years old. There has been a steady decrease in this number, and currently it's only a few out of 1,000 babies could not reach to 5 years old. Next slide, please. See these portions. We are already, the under 5 mortality rate nowadays is already under 2. There is very limited actually extra margin for us to improve. We've already reached to the ultimate status with regards to the under 5 mortality rate. Next slide, please. This is the proportion of Japanese male and female surviving to each age immediately after the World War II. In 1947, just 2 years after the end of the World War II, in Japan, less than half of us could reach to 65 years. And it's very rare for somebody to reach to 90 years old. Next slide, please. 80 years since then, nowadays, the situation is totally different. Almost everybody, more than 90% of Japanese male and female, reaches to 65 years old. It's very common to reach to 75. Half of Japanese women reach to 90s. 1 out of 4 Japanese male reach to 90s. Even 95 years old, the 1 out of 4 Japanese female reach to that stage. So there is a substantial increase from the standpoint of the survival curve in Japan in the past 80 years. This is the fundamental basics of the population aging in Japan. People, majority of us reaches to the mature age of 70s and 80s and even 90s. Next slide, please. This is the conceptual actually slides of what happened in the past few centuries. Evolution of survival curves. In 19th centuries, as we show in the previous slides, let's say about 20% of the newborn babies could not reach to 5 years old. And by the time we reach to 65, the half dies. There is a substantial increase from 19th century to 20th century. By the time 20th centuries, majority reached to 65. Now we are 21st century. More than half in Japan reaches to the age 80. Next slide, please. Could we improve this survival curve furthermore? Perhaps not. We've already reached to the near ultimate status of the survival curve in Japan. And whatever we do, only small margin remains for future extensions. As I explained, even though all the cancers are cured or eliminated, the actual improvement of the life expectancy is more or less 3 years only. So we've already reached to the final stages of the demographic transition, with only small margin remains for us to further improve our health status. This is the current status that Japan has achieved nowadays. Next slide, please. This actually, the demographic transition also makes or accompanies with the epidemiological transition as well. And I will show you 2 slides to compare the actual distribution of disease burden before population aging and after population aging. This slide shows the global distribution of disease burden 30 to 40 years ago in 1919. This is the global picture. This picture actually represents the actual share of each key diseases in the globe. The blue color represents non-communicable diseases. The orange and red color represents communicable diseases. Green colors represents accidents. And if the color is thick, this actually means the actual disease burden is increasing. The color is light, the actual disease burden of that disease is lightening or becoming better. In 1990, in the global situations, you could see that still communicable diseases representing the orange to red color shares less, roughly speaking, half of the total disease burden. Still, neonatal issues, tuberculosis, LRI, lower respiratory infections, and diarrhea, measles, malaria. These infectious diseases are the major cause of the disease burden in the world. Next slide, please. Next one, please. Or the one before. So what the world looked like in 1990s, the key features of the global disease burden at that time is communicable neonatal and nutritional conditions dominated. Child survivors was the central of global health agenda. Premature death was common across the life course. And non-communicable disease indeed existed, but played a secondary role globally. And population aging was not yet a defining global phenomenon, just 30 to 40 years ago. In 1990, global health was primarily about survival, not the aging. The situation is now changing now. Next slide, please. Here is the after the population aging. This is the actual distribution of disease burden in Japan in 2023. There is a substantial difference that we could observe here. The orange and red color that represents communicable diseases consists only a small fraction of the total disease burden. The major disease burden, 80% of the whole disease burden are coming from blue color, means non-communicable diseases. And even among the blue colors, there are thick dark blue colors, and which means that situation is worsening, and the bright blue color situation is becoming better. One of the biggest and the darkest is Alzheimer's disease. And the other, the dark color, which means that the situation is worsening, is pancreas cancer or prostate cancer. So these are the key diseases, and we could also find the major diseases like stroke, ischemic heart diseases, IHD, or back pain, or COPD, chronic obstetric pulmonary disorders, and so on. CKD represents chronic kidney diseases. Diabetes actually is a substantial burden, you could see. So this is the current actually picture of the distribution of disease burden nowadays, which is totally different from 30 to 40 years ago globally. Next slide, please. This actually slide represents the key contrast between 1990 global versus 2023 in Japan. Regarding the population structure in 1990 globally, the young population dominates the population structure, which is not the case anymore in Japan today, which is super aging society. Then the main health challenges in 1990, 30 to 40 years ago, it's survival, how to survive, especially in the younger age, which is totally different in Japan. The under 5 mortality rate in Japan nowadays is less than 2 out of 1,000 newborn babies, as I said. Then the challenge now in Japan is living with chronic conditions, especially in the senior ages. Dominant diseases in 1990 globally is communicable, neonatal, nutritional, which is not the case anymore in Japan today, where the non-communicable diseases are the dominant issue. Major cause of burden in 1990 globally is some of the key communicable diseases like diarrhea, pneumonia. Nowadays in Japan, which is totally different, the major issue is cancer, dementia, diabetes, and like. The nature of disease burden 1990 globally is premature death. Many people die in before the senior age, like under 5 mortality still high, or many people die before reaching to 60 years, 70 years old. Nowadays, 2023 in Japan, the nature of disease burden is more on long-term disability. Population aging was not yet a defining factor in 1990, while it is a defining driver in Japan today. So there has been a clear contrast between 1990 global and 2023 Japan. Just 30 to 40 years, there is a substantial transition, both demographically and also epidemiologically. So this is the world that we are experiencing today. Such a huge change. Next slide, please. This change actually makes us to face with the new challenges because many diseases are age-related. Typical example is Alzheimer's disease in Japan. Alzheimer is one of the biggest emerging new challenges in Japan because it is age-related. This graph actually shows the prevalence of Alzheimer's diseases, which is the major cause of dementia in Japan by age groups. Among 65 to 69, the prevalence of Alzheimer's disease is quite low, let's say 1 to 2%. It's not common among this age group, while it gradually increases as people ages. And if you become 85 years old or more, the prevalence is already as high as 30%. Please note that previously, that it's not common for Japanese people to reach to 85 years old. So the Alzheimer was not a serious issue. But nowadays, let's say nearly half of the Japanese population reached to this age group, where the prevalence of Alzheimer's disease is already as high as 30%. Next slide, please. Same is true for other diseases. And this is the prevalence of hearing impairment, or nancho in Japanese, in Japan, by age group. The hearing loss is becoming an emerging health issue in Japan simply because the population as a whole is aging. The hearing impairment is not a serious issue if you are in your 40s and 50s, but it actually affects you when you become 60s, 70s, and 80s. By the time you become 80 years old, which is not rare anymore in Japan, majority of us suffering hearing impairment. Next slide, please. The risks, for many diseases, one of the biggest risks is age. It's not a modifiable risk, but it is a risk. And if this is the case, we want to see how is the population pyramid in Japan. This is the current population pyramid in Japan, which is quite unique. We have two, actually, the populace, the age group in Japan. One is currently in their late 70s. The other is about 50 years old. You know why? After the World War II, many people or soldiers returning from outside to Japan. Few years later, there was a baby boom in 1947, 8, 9, 1950. This is the first wave of the baby boom, or in Japanese language, we call it Dankai no Serai. These generations are currently already in their late 70s, making one big, actually, the population groups, as you see in this population pyramid, followed by what we call Dankai Junior, the second generation of baby boomers, who is currently about 50 years old. And somehow their next generation, third wave, did not happen. This is the population pyramid in Japan nowadays. You could easily imagine that what happens 5 years from now, then the baby boomers generation becomes over 80. What happens in 10 years from now? The baby boomers generation reaches to nearly 90. And also the baby boomers, the second wave, or baby boomers juniors, are actually becoming in their 60s. And you could imagine many diseases like hearing impairment or dementia are age-related. What would be the situation there? Next slide actually represents, and this is the Jankai generation, and this is the Jankai Junior. And no third wave happened. Next slide, please. And this is the population pyramid in Japan. Sorry, this is the misprint. It's not 2025. This is 2055. This is the final stage of the demographic transition in Japan. No society in human histories actually represents this kind of pyramid. Usually in a population pyramid, by definition, the most popular segment of the population is infants. They gradually decrease as the people ages. This is not the case in 2055 in Japan. This is the population pyramid completely upside down. This pyramid actually surely comes in 30 years from now. The most popular segment of the population is not infants, not toddlers, not school children, not adolescents, not college students, not somebody in their 20s, not somebody in their 30s, not 40s, not 50s, not 60s, not 70s. 30 years from now, the most populous age segment in Japan is the people who is 82 years old. No society in human history ever experienced such an extreme situation. This is the situation we are going to face 30 years from now. And nobody knows how to support this kind of population pyramid. Next slide, please. Here's the Dankai Jr. Okay. This is the share of the population aged 65 and over. The trend since 1950 was 2050. Many people know that Japan stands out the rest of the world. Japan is one of the most rapidly aging society with the highest aging ratio currently. Currently, the aging rate in Japan is 30%, means that 3 out of 10 of Japanese are already 60 years old or senior. I think this slide is a little bit misleading. I mean, this slide does not make us fully recognize what is happening in Japan. For us to better understand the Japanese demographic transition, we need a longer the lifespan, longer actually the term. Next slide, please. This is the ultra long-term trends in population aging in Japan from 1400 to 2400. You could see the extra long-term, ultra long-term trends of Japanese population aging. This actually graph shows how many portion of our populations are 65 years old or older. Before 1900, the share of the population, people who is 65 years old or older, is very small, and it reaches to 5% in last century. Suddenly, it actually rapidly increases. And next slide, please. We are here, 30% of our populations are already senior, 65 years old or older. And this figure actually overshoots in the next 30 years, then expected to gradually decline to reach to the current status. We could see that the next 30 years is quite unique in Japanese human history, or Japanese history, or human history anywhere in the world. I mean, next 30 years, actually, there is likely to be an overshoot of the aging in Japan. Next slide, please. This has a huge implication to every aspect of Japanese society, but one of the notable, actually, the influence or impact is health financing. This is an estimated the medical and the long-term care expenditure by age group. Understandably, as the people ages, we need more medical expenditure, more long-term expenditure. Next slide, please. The baby boomer generation in Japan, or Dankai Sedai, is here. This is where the baby boom generation is concentrated. Then 5 years from now, this generation moves to the next level. 10 years from now, this generation, the baby boomer generation, actually moves one step towards the right side. And the financial implication to the nation is huge. I myself is afraid most likely we could not actually able to sustain our health systems in the next 10 to 20 years. Next slide, please. we've been actually seeing only one dimensions of the population aging challenges. One challenge is, as we've reviewed, is aging rate. That is, percent of population aged 65 years old or older, we've observed. But this is not the whole story. We actually need to see the three different dimensions. The second dimension is socioeconomic and the social characteristics of the seniors in terms of the wealth or social capital. The third element is living environment of all the adults, like where they are living. Let us see one by one. Next slide, please. Actually, it's not just population aging, but the nature of the seniors are gradually shifting. This is the comparison of baby boomers, who is currently in their late 70s, and baby boomers juniors, who is currently around 50 years old. We could see that these two different generations are facing challenges different from the past. Let's see one by one. Spouse. Baby boomers generations currently in their late 70s, many of them, I would say majority of them, have a spouse. But for junior generations currently about 50 years old, some of them, let's say 10, 20, or 25% of them does not have a spouse, remaining single. This actually affects the number of children. Baby boomers generations are currently in their 70s. In average, have 2 kids. Juniors, more or less about 1 or 1.1, 1.2, 1.3. So the lesser number of children who supports these seniors. This is also true for siblings. Baby boomers generations currently in their late 70s, they usually have many siblings, brothers and sisters. 2, 3 brothers and sisters is quite common, which is not the case for junior generations. And also their wealth status is different. Baby boomers generations benefited by stable employment, or shushin koyo in Japanese, that actually makes them possible to have a decent savings and pension, which is not the cases for junior generations. Junior generations, many of them do not enjoy the shushin koyo or stable employment status, which affect their future savings and pensions when they become old. And this is not just the generation itself, but also national power is different. Currently, baby boomers generations are in their late 70s, already senior the age. Currently, Japan, still the national power is reasonably strong. But 20 to 30 years from now, when current junior generations, Dankai junior generations becomes older, most likely our national power becomes weaker. So when junior generations, currently about 50 years old, becomes old 20 years, 30 years from now, they may face different challenges than baby boomers generations currently facing. Perhaps the situation is tougher, more dire. We need to keep it in mind when planning for the future. Next slide, please. The third dimension that we need to consider is the actual places or environment where people is aging. This is the map of Japan. Think about it. Which regions of Japan are aging most rapidly? Of course, Japan is the most rapidly aging country in the world, but the actual speed of the aging is uneven within Japan, region by region. Next slide, please. The Greater Tokyo area, as you see in this map, is the one of the fastest population aging regions ever observed in human history. So Japan is actually unevenly aging region by region, and the fastest aging region is suburb of Tokyo, presented in this mapping for a certain reason. Next slide, please. This is the reason why Greater Tokyo area is aging so rapidly. Urban versus rural aging, distinct challenges across time. This actually graph represents the trends in the urban population share in Japan from 1950 to 2050. After the World War II, around 1950, only 1/3 of our population is living in urban settings. This figure gradually increases, and currently more than 2/3 of the people are living in urban settings. In the past 80 years, next slide, please. There has been a steady, consistent move of younger workers from rural to urbans. So many high school graduates or college graduates are moving from rural prefectures to Tokyo, working in Tokyo and living in Chiba, Saitama, Kanagawa, the outskirts of Tokyo metropolitan. This actually makes us some challenges. Next slide, please. Because of this, in rural areas, there are fewer younger generations. Caring for all the seniors who remain in the rural areas has been the main challenges. On the other hand, in the urban settings, caring for seniors in isolations becomes the main agenda. I mean, when people move from rural areas to urban areas in 1960s and 70s, these are the young workforce in their 20s. But 50 years from now, 50 years since then, these then younger generations are now currently in their 70s, do not returning to rural areas, but they are remaining in urban settings. And this is the reason why the Tokyo metropolitan is the fastest aging the areas in Japan and in the world and in human history. Next slide, please. So this actually makes us two distinct challenges. One is in the rural settings. Disappearing community or Genkai Shuraku is the issue there. On the other hand, in urban settings, especially the suburb of the Tokyo metropolitan, the communities with weak social capitals is the issue. Next slide, please. Now it's the mid of the lecture. Just give me a few bio breaks. I will return in few minutes. Just a few bio breaks, please. And we will resume the lecture from this picture. Thank you for waiting. Let us resume our lectures. This is what we call aging hotspot, the apartment complex in the suburb of Tokyo. There are dozens or hundreds of this kind of the huge apartment complex in Chiba, Saitama, Kanagawa, the suburb of Tokyo, which was constructed in the Japanese economic booming period of 1960s and 70s. Many younger generations moved from rural provinces to suburb of Tokyo, living in this kind of apartment complex. Then 40 to 50 years since then, this apartment complex still remains. And people moved from rural provinces to Tokyo are still living there. Before they were young, they were in their 20s, 20s and 30s, and with 2 or 3 kids, the first time there. Nowadays, all the kids are already grown and going out from these places. Only the aged parents are remaining here. Then another quiz. Among the seniors in this housing complex, what percentage were born and raised here? The answer is obvious, 0%. Nobody were, for those who is still remaining here in their late 70s or Dankai Sedai, nobody was born here. All of them were born in provinces, moved here when they finished their high school or colleges, have been living since then, and then now they are aging, but with a very limited the social capital. In many cases, there is a very limited actually connection between residents in this apartment complex. This is totally different from the conventional context of community. Next slide, please. This picture actually represents the traditional concept of aging. In many rural communities in Japan, when people wake up in the morning, they usually open the door if it's not raining, if it's not very cold, to send a signal to the neighbors that I'm fine today. This is quite important when you are living alone in your 70s or 80s. Even though you are living alone 70 years old or 80 years old, by opening a door in the morning, you could send a signal to the community, to the neighbors that I'm fine today. This is what we call aging in place. People are cared by the community, naturally cared by the community, which is not the case in urban settings anymore. Next slide, please. The one slide, the upper left side is a picture of my hometown in rural provinces. The other, the right bottom side picture is an apartment complex where I have been living until recently. So in just one generation myself, I transferred from the traditional community to the modern community. In a traditional community in villages, everybody knows me. So I'm comfortable to living there. Actually my 19 years old mom is living alone there, cared by the community because she was born here. She has a quite strong connectedness with all the neighbors there, which is not the case in my current residence in urban settings. I even do not know who is living next door. There is a huge difference in terms of the social capital from the rural settings to the urban settings. This has an implication in population aging. Next slide, please. It's not easy, or it has additional challenges when people are aging in big cities or urban settings, as we described. Before, there was not that much big cities. In 1960s, we had only 2 mega cities. Mega cities defined as a city with more than 10 million populations, which was New York and Tokyo, only 2. Next slide, please. 20 years later, 1980, we had 4 mega cities New York, Tokyo, plus Mexico City and São Paulo. Next slide, please. Few decades later, 2011, we had 23 mega cities. Please note that many of them are actually in middle and low income countries, some from Africa, a few from Latin America, and many from India and also China. Next slide, please. This is the current status in Japan, in the world. In 2025, we already have 37 mega cities in the world, many of them in emerging countries. And what's the implication of this proliferation of mega cities to the health of the people in the globe? Next slide, please. This is trends of the urban population share as we actually presented a few slides ago. Next one, please. Japan is not unique. This is the global trend. In the past several decades and in the next few decades, Japan is only one generation ahead, or one generation ahead from the middle-income countries, and 2 generations ahead from low-income countries. Everybody in the world, not only in Japan, are moving from rural provinces to urban settings and keep on living in urban settings as people ages. So the actual environment of the care for senior population is totally different from the previous settings. Previous settings, people are well cared by the community because people know each other, which is not necessarily the case in an urban aging, as we saw in Japanese situation, especially suburb of Tokyo. The world is aging, becoming more isolated. In many cases, these people do not know who is living next door and concentrating in cities. So the actual aging issue is not just many people are aging, the ratio of senior people are increasing, but also the nature of the senior people are transforming. And also the places and the environment of the senior people are transforming, not only in Japan, but just one generation behind the middle and low income countries as well. The aging is a global phenomenon. It's not just a biological age, but the environment that surrounds the senior populations. And the actual nature of the senior population is transforming. Next slide, please. Previously, until 10 years ago, Tokyo is ranked #1 biggest big cities or urban agglomerations in the world. This is not the case anymore nowadays. Tokyo, until recently, has been the biggest city in the world for several decades, are now overpassed by other cities. Not overpassed by New York, Paris, London, but overpassed by Jakarta and Dhaka. This is the list of the top 10 most populous urban cities in the world. You could notice that many of them are actually coming from emerging countries. They are actually experiencing the same thing which happened in Tokyo. Tokyo actually increased ballooning its size because many people from rural province are actually migrated from rural to urban when they were young. And 3-4 decades later, this young workforce becomes in their 60s and 70s and not returning to their hometown, but going to age in big cities, in many cases with limited social capitals. That is what we are currently experiencing, especially the suburb of Tokyo. In the next decades, the same thing is likely to happen in the suburb of Jakarta, Dhaka, Delhi, Shanghai, and many other big megacities in emerging countries. We still do not know how is the situation in reality. Next slide, please. Everybody knows that Japan is the most aged society, or one of the most rapidly aging society. But in terms of the actual number of the seniors, population aged 65 and over, Japan consists only a small fractions. In terms of the actual number, the aged population is more in China or in other parts of the world. Next slide, please. We are currently here, 2025. Here is the next 50 years. You could easily understand that the population aging is not unique in Japan, but it's a global common health agenda. Without actually understanding this common agenda, we couldn't write an effective policy brief. So understanding the population aging in the world is one of the prerequisites for us to make effective policy brief on global health agenda. Next one would be the final slide. Next one, please. In summary, for us to actually understand each and every health agenda in the globe, the very basic is understanding the population aging of the globe. The 21st century is an era of longevity, not only in Japan, but in many parts of the world, even in low-income or middle-income countries. Everybody could able to, not everybody, but majority of us could reach to a senior ages. This is the first time in human history. Japan is the first country in history where majority live to an old ages, in their 70s, 80s, or even 90s. And through mid-21st century, Japan cares the baby boomers who is currently in their 70s, and also their juniors currently around 50 years old. This actually makes us a very strong pressure financially. How to sustain caring of them financially is a huge challenges in the next few decades in Japan. What lies ahead of Japan is challenges that is differ from the previous rural aging. In the previous rural aging, the people are more or less cared by the community, which is not the case anymore in the current urban agings. Social isolation in urban settings is the issue, in addition to the biological aging of each and every populations. And this situation is not just unique in Japan. The world is catching up with Tokyo. The world is rapidly urbanizing, as we saw already. There are 37 mega cities or cities with more than 10 million populations. Many of them are located in emerging countries, growing old in urban settings with limited social capital. Social capital means the connectedness of the people in the community. So what we are currently experiencing in Greater Tokyo, including the outskirts of Tokyo, represents the future world. And actually many health policy planners in the world are coming to Tokyo to observe what is happening in Tokyo, because everybody understands that that's the reality they are going to face in the next few decades. In summary, for us to better understand the global health agenda, one of the key elements is understanding the population aging of the world. And for us to prepare effective the briefing in any agenda of health, like cancers or health emergencies or cardiovascular diseases or obesity, whatever, the very fundamental, the agenda is the aging of the populations. And I hope this presentation is helpful for you to describe or prepare your policy brief of your agenda. Thank you very much for your attention.
Professor Inoue, your lecture gave us a powerful framework for understanding the challenges we face, aging, and the transformation of disease burden. If I may, I would like to ask a few questions with our student in mind. Because of the disease burden has changed so dramatically, we now need to mobilize the sectors beyond healthcare, long-term care, employment, urban policy, education, and more. From a system perspective, where should we start in building cross-border and cross-sector partnership between government and industry and across ministers? Please advise.
Previously, in the government, it's a responsibility of the health ministry to care about the health of the population, which is not the case in the coming decades, in my understanding. Mainly because the addressing of the health closely linked with how to finance the care. As the population ages, there is a huge pressure in financing for healthcare, as we actually described in one of the slides. Actually, the care for seniors cost a lot. And many actually countries, as we gradually aging, are suffering from the financing for healthcare. So I understand that we actually do need a more involvement, first and foremost, in addition to the Ministry of Health, is the involvement of the Finance Ministry. And this is actually what the Japanese government, in close collaboration with WHO and the bank, is doing. Last year, the Japanese government actually established a so-called UHC Knowledge Hub, Universal Health Coverage Knowledge Hub, to share the knowledge on how to achieve universal health coverage in collaboration with WHO and the World Bank. One of the unique characteristics of this newly established UHC Knowledge Hub is this hub actually tries to involve not only health ministry, but also finance ministry. And this is the reason why the Japanese government approached both, not only WHO, but also World Bank. So one of the biggest challenges for us to maintain the health service or achieving UHC is financing to them. Mainly because as people ages, we have a huge pressure in maintaining the health sector or healthcare from the financial point of view. Thank you.
Thank you very much, Professor Inoue. Finance, the healthcare is a very, very important matter. Students, are there any questions?
Sensei, I have one question.
Yes, please.
Thank you very much for this very interesting lecture. I think the data are very rich and interesting. Yeah. So my question is about the current and future young generation in Japan. What kind of academic skills should they focus to support this kind of aging society in next few decades, Sensei?
Could you please repeat the question? What kind of,
Ah,
you are asking about the younger generations in Japan, and
yes.
could you please repeat your questions?
What kind of academic skills?
Academic? Sorry.
Yeah, yes, like academic skill, what kind of major, what kind of education they need to focus to support aging society in next few decades?
Actually, when you become older, many of the diseases are lifestyle related, like cardiovascular diseases, stroke, diabetes, and even dementia. All these diseases are closely linked to people's lifestyle. So for us to better manage the health of the population, rather than actually just providing a health care, one of the most important elements is actually modifying or improving the lifestyle of each and every people and each and every population. So for us to maintain this super-aged society, one of the most important elements is how to improve the lifestyle. Lifestyle means that the way people eat, the way people exercise, the way people sleep, or way people manage the stress. These are quite important. So I think it is quite important for us to investing on health educations or investing on the health literacy across all age groups. If you could effectively educate younger generations with regards to how to maintain their lifestyle in terms of exercise, diet, etc., it has a huge impact when they become a senior age. So for us to maintain the super-aged society, of course, we do need a lot of more doctors, nurses, hospitals, medicines, etc. But first and foremost, one of the most effective intervention is try to modify the lifestyle of each and every people. And this is one of the key elements for us to maintain our society in the next few decades. Thank you.
Thank you very much, Sensei.
Is there any other questions from students? Since I have a question.
Yes, please.
As maybe according to your slides, actually Japan also can be called the pioneer that facing the aging society. And what do you think about, what is the one lesson that you think today other countries should especially learn from Japan's experience to handle the aging society? What is the key lessons?
Actually, Japan is still on the way towards the final stage of the aging society. Could you please show us the slides of the population pyramid of 2055? The population pyramid of 2055. So this is the population pyramid of, it's a typo, not 2025, but 2055. 30 years from now. And this is the final stages of the population aging in Japan. We still have 30 years to reach to this ultimate the status. So we are still not sure whether Japan could successfully manage this ultimate population pyramid 30 years from now. I myself is a little bit pessimistic. We may not actually able to sustain such an extreme population pyramid in the next 30 years. So I'm quite not sure whether we could offer a good or a good lesson to the rest of the world. Perhaps to a certain extent we could success, but to a certain extent we may fail to sustain such an extreme population pyramid 30 years from now. So I'm sure that Japan is going to send a mixed message to the rest of the world, some success and some failure. But there are a few actually important lessons that we are going to send to the rest of the world. The one element is the importance of recognizing the impact of the urbanization. What we are going to experience is not simple a population aging, but the population aging combined with the urbanization, combined with isolations or limited social capital or limited connectedness among people. How to actually recreate the community in urban settings is what we are going to try now at the outskirts of Tokyo. And these experiments in the coming years would be one of the biggest lessons to the rest of the world. The second lesson that we are going to show is how to manage this aging process financially. We couldn't foresee an effective approach to finance such a huge super aged society. So how to manage this situation financially is the second lesson that we are going to offer to the rest of the world. The third lesson is, as I said, the importance of the lifestyle, how to manage or the lifestyle of the population is the approaches to improve the lifestyle of the population is the third lesson that we are going to provide to the rest of the world. So I'd say these three, the urbanization, how to handle the urbanization combined with the aging, this is the first. Second is how to finance these aging, the populations. The third is how to improve the lifestyle of the population. These three are actually what we are trying to improve currently, and the success and the failure of these three elements of the trial could be one of the important lessons that we could actually provide to the rest of the world. Thank you.
Thank you so much, Sensei. I understand.
Professor Inoue, thank you very much for your very meaningful lecture. You have made remarkable contributions not only in Japan, but also on the global stage. If I may ask one question on behalf of our students. Many of them hope to become a globally minded professional who can work across borders and sectors. From your experience, what does it truly take to become a global health policy leader or more broadly global professional? What skill, mindset, and daily practice would you most strongly recommend it to students at the University of Tokyo and Gifu University? I would greatly appreciate any advice you could share.
Thank you for your questions. I think the students in this class already benefited from learning from other countries. Many of these students are actually coming from their home country to Japan, learning from the lessons and experiences of other countries, and also sharing the experiences among their home countries and also the classmates' home countries. This actually, the comparison of the different health systems or the health situations makes the health policy planner more objective thinkings. So I think the students in this class already have a huge benefit in attending this class or attending these courses by recognizing the difference of the policies and situation in their home countries and also the rest of the world. This comparative the view of their one country and other country actually makes us our policy planning more objectives and more effective to apply in their home countries. So you are already doing a lot of benefits by attending these courses, and please keep on studying in comparing the systems and the situations of several different countries. Thank you.
Professor Inoue, thank you again for an outstanding lecture. Please work on it as a practice for writing your final report. The student as a homework is available on the UTokyo in the website. And the next week will be the final session of this lecture series. We will introduce the concrete ongoing project currently taking place in both Malaysia and Japan, and we will be joining by researchers from both sides. Until then, thank you very much. Professor Inoue, thank you very much for a splendid lecture. Thank you very much.
My pleasure.
I look forward to seeing the student next week. Thank you.
Thank you. Bye-bye.